The pandemic continues to pose a number of health challenges. In today's For Your Health, Kelly Taylor looks at what that can mean for women who are expecting.
Pregnancy comes with its own set of unique challenges. Add in a global pandemic and the situation becomes more complicated. Dr. Christy Weaver, board-certified OBGYN, joins us with some tips to help expectant mothers have a smooth pregnancy. Doctor, what advice do you have for women who are pregnant or trying to become pregnant right now?
Thank you for having me today. Right now, we are advising women to go ahead and proceed with pregnancy as scheduled and as planned. It's nice to be able to say that. A year ago, we didn't know what to tell women. Right now, we feel like we've really gotten a good handle on COVID, especially during pregnancy. And although pregnant women are at increased risk during pregnancy, we want them to stay safe, but we know that they can have a healthy pregnancy during COVID.
So you said we're kind of a little out of the woods, I guess you could say. It's been a year later, but are those COVID safety measures still in place at doctors' offices and hospitals?
At most doctors' offices and hospitals, you will continue to see COVID safety measures. We know, because of the nature of the healthcare industry, that patients are more likely to be ill when they come to the doctor or go to the hospital. So we have kept those safety measures in place to protect our healthy patients, like our pregnant mamas, to make sure that they can safely seek care at offices and at the hospital.
You have a lot of experience with high-risk pregnancies, also delivering multiples. What are some tips you would give to those families?
Any pregnancy that is of multiple gestation is at higher risk than a singleton. So those mamas especially need to continue to be careful and take their good COVID safety measures. But again, we are delivering them all the time and having good, healthy outcomes for those families as well.
And once someone learns that they're having more than one child, what advice do you give them?
Certainly, you want to make sure you are seeking out a healthcare provider that is a specialist in multiple gestations. Even with twins, there are different types of twins, and the type of twins that you have will dictate how high or low risk your pregnancy may be. So make sure you have an experienced provider and make sure you're delivering at a place that is able to take care of little ones, especially premature babies, because multiple gestations are likely to come early.
We have about 30 seconds left for this last question. Is there any other information or tips that you'd like to give to anyone watching?
I think the biggest message right now is please continue to seek care at your doctors and at your hospitals. We, again, have a good handle on this. The hospital is a very safe place to deliver, even in the midst of this pandemic. Despite the scary things we've seen in the last year, labor and delivery has always been a fun place, and we're making miracles every day. So that's been a blessing.
All right. Thank you, Dr. Weaver. Those babies come whenever they're ready.
They do indeed, even during a pandemic.
For sure. Thank you for talking with us this afternoon.